Hello everyone, this is Professor Leon. Today we will go over the concept of hypertension. Hypertension is preventable and treatable. Therefore, it is important that people know their blood pressure level. So today we are going to be getting our blood flowing. Does anybody in this class know how blood is moved throughout our body? I'll give you guys 5 seconds to think about it. All right, some of you may say the pump, or gravity, or the heart, and so on and so forth. So yes, the heart is responsible for moving our blood, and it does pump. But how does it do that? I'll give you guys another 5 seconds to think about it. So some of you would say that it beats, it acts like a car, and so on and so forth. So the heart does beat. But the way it moves blood through the body is by pushing more blood behind it. The heart is a pump that uses muscles to create pressure differences to move blood. Blood, just like any liquid, travels from areas of high pressure to low pressure. Now, the pressure gradients created by the heart are determined by 3 factors. First, the amount of contractile force made by the heart. In layman terms, basically, it's how hard the heart muscle contracts when pumping blood. The second factor is the amount of fluid the heart must pump. And then the third one is the amount of resistance in the vascular system. Once pressure is created in the heart, this is done through the contractions of your heart tissue, blood is expelled into vessels called arteries. The venous system is not really discussed in this concept because if you guys remember, hypertension affects primarily the arterial tissues, and it is these vessels that are the targets for pharmacological agents to alter blood pressure. A major measurement of cardiovascular system's ability to transmit blood through the body is blood pressure, or BP. Blood pressure, as many know, contains 2 numbers, the top number and the bottom number. When the heart pumps or contracts, a physiological event called systole, it creates a pressure inside the arteries of the body. This pressure wave, felt by the pulse in various locations of the body, pushes blood at a high velocity throughout the body. This initial wave of pressure through the body must be high to propel blood throughout the entire body. Putting this all together, the systole of the heart creates a high pressure in the major vessels just outside the heart, which is used to drive the blood flow throughout the entire body. Likewise, the systolic pressure of blood pressure measurement is the higher number and represents the highest pressure achieved by the heart during contraction. After the heart beats, it takes a rest and allows blood to flow throughout the body and return to the heart. This rest gives the heart muscle time to relax. In addition, the pause taken for rest gives the heart time to prime its pump and allow blood to recollect inside itself. During this period, also known as diastole, the pressure is usually much lower. Likewise, the diastolic pressure is the lower number and represents the amount of pressure of the system during the heart's resting period. So in summary, blood pressure is the pressure exerted by circulating blood upon the walls of your blood vessels. Your systolic pressure is measured between when your heart contracts, and we normally would hear it as lub, L-U-B, and the diastolic pressure, which is measured between beats when the heart relaxes, and you would hear it as a dub, D-U-B. So basically this slide goes over the classification of blood pressure. Hypertension is a chronic condition characterized by a sustained diastolic reading greater than or equal to 80 millimeters of mercury and a systolic reading greater than or equal to 120 millimeters of mercury. Occurrence can damage blood vessels and increase the probability of development of abnormal fatty deposit in the artery. Treatment is aimed to decrease morbidity and mortality. So what causes hypertension? Over 90% of hypertension in the United States is essential or idiopathic hypertension, or you could say primary hypertension. It basically means it's without an identifiable cause. And about 10% of hypertension is secondary to some identifiable cause, which could include the use of steroids, some renal vascular disease, pregnancy-related, renal parenchymal disease, pheochromocytoma, your Cushing's syndrome, if you have a coarctation of the aorta, or even primary hyperaldosteronism, to name a few. So what are the factors that regulate blood pressure? First, we're going to go over endogenous, and then the second one is exogenous. There are many different ways the body can regulate peripheral resistance. The first one is the renin-angiotensin-aldosterone system. We also call it RAAS or RAS. The body uses the RAS to regulate normal volume of the cardiovascular system. When blood volume is low, the kidneys realize this and releases renin, which is then secreted into the blood. Renin flows through the blood and converts angiotensin into angiotensin 1. Angiotensin 1 is then converted into angiotensin 2 by the action of the angiotensin converting enzyme, or ACE. The angiotensin 2 hormone is an important vasoconstrictor. What it means is it decreases the radius of the blood vessels. Also, angiotensin 2 can stimulate the production of aldosterone. Aldosterone prevents the kidney from excreting water and sodium into the bladder, which is then released through urination. Likewise, aldosterone allows the body to hold on its water and sodium, which helps to maintain blood pressure. In summary, the secretion of renin by the kidney leads to vasoconstriction, again a decrease in arterial radius, and water retention, an increase in blood volume. Both things lead to an increase in blood pressure. The second one I want to go over is the adrenergic receptor systems. The nervous system contains two divisions, the parasympathetic nervous system, PSNS, and sympathetic nervous system, SNS. For both systems, there are chemicals, enzymes, and hormones that can activate, called agonists, or block activation, called antagonists. These agonists and antagonists are called ligands. Ligands work by interacting with receptors found on cell membranes. This interaction causes a response that is prescribed by each ligand or receptor. So for example, the SNS agonist epinephrine would increase heart rate, while an antagonist drug such as a beta blocker would slow heart rate. In general, the SNS is used for flight or fight responses. In other words, when a rabid grizzly bear starts running after you, your SNS increases your heart rate, dilates your blood vessels, and allows you to either fight the bear, which is not advisable, or flee, run away. Now your PSNS is the chill system. In terms of human, the PSNS controls sludge. So what is sludge? Salivation, lacrimation, which is also known as crying, urination, defecation, gastrointestinal tract movement, and emesis, which is also known as vomiting. These actions allow for normal bodily functions to occur. Again, once you have dealt with the bear from that SNS example. The receptors that work specifically for the sympathetic nervous system, which is your adrenergic receptors, are found throughout the body and control a multitude of functions. So the adrenergic receptor system is further complicated as it is broken down into two divisions, an alpha and a beta, or I should say beta. The alpha adrenergic 2 receptors activate smooth muscles of the arteries. Smooth muscle is muscle that lines much of our internal organs and is used for general internal organ movement, including the vessels of the cardiovascular system. Likewise, alpha 2 receptors have implications for blood pressure regulation. Now, the actions of beta adrenergic receptors can be easily remembered by remembering their number. Beta 1 receptor affect our one heart, while beta 2 receptors affect our two lungs. While the complexity of this system allows the specificity of its action, cross-activation of receptors can occur with certain pharmaceuticals, or should I say drugs. Without confusing you, I just want you guys to think this when you're done going over the pharmacological management of hypertension. So for example, if a patient is having an asthma attack, a paramedic may administer an albuterol nebulizer. So albuterol is a beta adrenergic drug. One thing the paramedic must monitor during administration is the patient's heart rate. While the albuterol is a beta 2 adrenergic agonist, such as it relaxes the smooth muscle in the lungs, causing the patient to breathe more easily, it can also affect beta 1 adrenergic receptors. Likewise, if a beta 1 adrenergic receptors are activated, the patient's heart rate increase. Remember, this is not a problem. However, if the patient is elderly with chronic heart failure and a history of heart attacks, elevating the heart rate may have detrimental effects. The third factor I want to go over under endogenous is calcium channels. So the contraction of cardiac muscle is dependent on the release of calcium throughout the cells of the myocardium. So remember, that is the heart muscle tissue. It is important to understand, however, that calcium is used for muscle contractions. For cardiac muscle, changing the permeability of calcium channels can affect the contractility of the heart muscle. This has implications for both inotropic and chronotropic changes in the heart. In endothelium smooth muscle, which are found in the arteries, changing the permeability of calcium channel affects its contraction, which in turn can cause changes in the vasodilation or vasoconstriction of these vessels. And one other really important control is the kidney. Another important facet to blood pressure control is the amount of fluid in the cardiovascular system. To an extent, more fluid in the cardiovascular system, of course without change in vascular dilation or constriction, leads to increased blood pressure. Therefore, the work of kidneys to maintain a balanced blood volume level is imperative for normal blood pressure. When blood enters the kidney, it is split into pathways that flow through the approximately 1 million nephrons. So remember, the nephron is the basic structure in the kidney that is responsible for filtration. As blood enters the nephron, it travels through a system of corresponding tubules that abut the blood vessel. Through changes in channel permeability in the nephron structures, salt and water can enter or exit the kidney's vessels. This exchange of salt and water leads to the production of urine, which is eventually excreted into the bladder, where it is eliminated during urination. Water leaving the cardiovascular system by accumulation in urine causes a decrease in blood pressure due to a decrease in volume. The less volume in the system, the less pressure the system exerts. Now let's look at a couple of the exogenous factors. There are many external factors that can affect the narrowing of blood vessels and likewise affect blood flow. Two main exogenous factors are most often concurrent with high blood pressure, that is tobacco use and high cholesterol, or we call it hypercholesterolemia. Nicotine is an active molecule in tobacco, can activate the SNS receptors, which causes vasoconstriction. While moving through the bloodstream, nicotine can also interrupt the normal functions of endothelium and cause them to harden. Cholesterol is a main exogenous cause of increased systemic vascular resistance in hypertensive patients. The common types of circulating cholesterol are your high-density lipoprotein, or HDL, and low-density lipoprotein, LDL. LDL is also known as bad cholesterol. In fact, refers to proteins specifically called lipoprotein that surrounds a cholesterol molecule. So when LDL associates to a cholesterol molecule, it is then called LDLC. Circulating LDLC has the potential to cause harm through the buildup of plaque in arterial blood vessels. On the other hand, your HDL, also known as the good cholesterol, is the protein that transports cholesterol molecules throughout the body. The good part of HDL is its interaction while holding on to a cholesterol molecule, thus becoming what is known as HDLC. Basically, your HDLC travels through the bloodstream and is used to clean up LDL. The buildup of cholesterol that causes hypertension does not occur within hours of eating a double quarter pounder, with or without cheese, but may take years to develop. Cholesterol starts as fatty streaks, then progress to fibrous plaque, forms of fatty streaks. This plaque is usually larger, firmer, and is gray in color. While fibrous plaque can occur in many arteries of the body, they are commonly found in the walls of the heart's blood supplying, also known as coronary arteries, locations along the aorta, which is the main artery of the body, carotid arteries, which supply blood to the head, and the circle of Willis, a main collection of arteries within the brain. Many problems can occur from the presence of these plaques. It can decrease blood flow through areas of increased plaque buildup. Decrease of blood flow can occur for two reasons. The first reason is due to the increase in radius of the artery walls due to plaque buildup. Known as atherosclerosis, presence of plaque can cause turbulent blood flow, which can lead to a decrease in downstream perfusion. Now, arteriosclerosis, or hardening of artery walls, occurs when fatty plaque builds up and prevents the body's endogenous control over vasoconstriction or vasodilation. Other complications that can arise from a fatty plaque include the potential for lethal thrombus. A thrombus is a piece of plaque that breaks off and causes blockages, called clots, downstream. This is especially dangerous when the clot forms in your lungs, also known as pulmonary embolism. Even more critical is when a clot forms blockages within plaque arteries and causes loss of perfusion directly downstream. This can occur in the vessels that deliver blood to heart muscle and cause a heart attack or myocardial infarction or MI, or in the brain causing a stroke or CVA. An overall decrease in blood lipid levels as well as stability of dangerous clot causing plaque can be achieved through drugs such as statins. However, this will not be discussed in this concept.